Thank you, sir, for that kind introduction. I'm sure all of us are very excited when it comes to myopia because there's a lot of changes which keep happening with myopia. And all of us, whether we are general ophthalmologists, glaucoma surgeons, cataract surgeons, or pediatric ophthalmologists, we do have kids in our OPD, and all of them are now wearing glasses. So let's find out the most important part of myopia segment. Does lifestyle matter? So the first question, why do we have so many master classes? Is myopia a big problem? So as a pediatric ophthalmologist myself with an interest in myopia, as well as being a father of two young children, 4 years and 2 years now, in Delhi, I am acutely aware of the need for to actively monitor, manage the visual experience of a young child to reduce the onset of and progression of myopia. So let's examine the different evidences and consider the conditions or the modifications that optimize visual health and reduce the risk of myopia in these children. So we all well aware of the Brian Holden Vision Institute study, which talks about 2050 being the year where every second child will be myopic. And we all believe now that COVID has played a role and that's accelerated. So why the fuss? So prevalence of myopia is already 80-90% of your young adults aged 17 to 18 in a study which was in Southeast Asian countries. But more importantly, myopia is beginning to be seen at earlier ages than before. And that means it's going to progress to be high myopia as we go on. So we already know myopia has been reported in children as young as 4 years and below, resulting in more years spent on progression. Thereby, they end up being higher myopes, and we all know what can happen if you're a higher myope. An increase in myopia is associated with increased risk of sight-threatening complications of pathological myopia, and this itself is causing a burden of around 202 billion US dollars per annum. And with inflation, that will just increase. And there is evidence that optical and environmental interventions both can halt the progress of myopia and reduce this burden. So this is how the medical burden of myopia looks. And there are various studies have been there talking about prevalence of myopia that is happening. We ourselves in Arunodaya in Gurgaon have done a study in the rural and the urban rural population of Gurgaon. So what do we know? We know that a lot of factors come into when we talk about myopia progression. So there's not one recipe which works here. One of the recipes that I'll be talking about in this multifactorial is lifestyle. So what is the evidence? In examining the evidence more closely, greater amounts of time spent outdoors is associated with reduced risk of myopia genesis and progression. Similarly, less myopia and better uncorrected visual acuity has been reported in children in China who spent at least 60 minutes outdoors, and more than 60 minutes outdoors, they ended up having less progression. So is myopia fast becoming more of an environmental epidemic than a genetic or familial problem? Afraid so. So two factors that make Southeast Asia a hub for myopia is intensive schooling here. We all are not satisfied with the few degrees, we want more, and lack of outdoor play. And if you're getting those degrees, you're basically indoors studying. So this is a study which is quite interesting. It's about environmental risk factors which were evaluated using a questionnaire, an environmental risk factor score, which was calculated with a backward regression analysis. And the genetic risk scores were calculated based on current knowing risk variants of myopia, the gene interactions, and the main part of this is that it's not just your genes. Genes can be the gun, but like Shruti would tell you, the trigger can be the environment or the lifestyle. So this is a photo that I love showing. It's by from my boss's slide. Dr. Minakshi talks about number of factors associated with being outdoors, like increased light, spectral composition of outdoor light, a flatter dioptric world, reduced pupil size, increased depth of field, and increased secretion of neurotransmitters, which may play a role when you go outdoors. So in this respect, it appears that bright light has a role to play, and data from animal studies report a reduction of form deprivation, myopia with high intensity ambient light exposures of up to 5 hours per day. This was a study which was done in chickens, and it showed that furthermore, daily exposure of the daylight actually reduced the axil length and progression of the axil length. Season 2 has a role. So furthermore, there are more studies which support the importance of outdoor play. In this data that demonstrates seasonal variation also has a play when you talk about accident elongation, and light intensity also matters. So that's got something to do with the season. So interestingly, I think all of us will do winter vacations in Australia to avoid the winter. So housing and architecture also has a role. We found this that cities which are packed were having more and more of myopia rather than the rural open architecture sort of places. Even houses like in Chandigarh, where you have more light happening, more area to breathe, they had less chances of progression of myopia. So this was a study from Australia and China, which do speak about better lighting in bigger houses being better than boxed apartments. So you may have to consider shifting out of your apartments if you're there. So it's also need to be remembered that in addition to association with outdoor time, myopia incidence and progression also noted with increased near work. And odds of becoming myopic increase 2% every diopter per hour when near work increases. And the near work categorized the risk factor of myopia includes reading, use of computers, mobile phones, video games, and more the near work result in a visual experience that results in hyperopic defocus due to accommodative dysfunction and or accommodative lag. And hyperopic defocus signals a growth to the eye, and that leads to increased axial length, and that causes more myopia. So this is something that I always write, that for my own OPD, that this is how the near work influences myopia. And education, of course, a lot of studies do talk about higher education being more myopic, and parental myopia is also another very, very important cause, which was blamed more so before COVID, and now we are going more with lifestyle. And peripheral defocus, we do speak about peripheral defocus and how that's caused the hyperopic defocus, and that causes more of progression. And what did COVID do? It increased our screen time. It caused more myopia now that we are seeing in more and more. I will speak about COVID myope in my next masterclass, which is tomorrow, which is on 14, sorry. So please be there. And now I'd like to speak about different treatments of myopia will be taken up. Now what we're going to talk about is what's up with myopia glasses. This is a little introduction. I love showing this in my OPD also, because it talks about peripheral defocus, which often the parents don't understand till you show them this nice little clip. It talks about the hyperopic defocus, which causes progression of the length. And now we have had a lot of new glasses which are there, and animal studies which do talk about this hyperopic defocus. And because of the use of progressives and bifocals being slightly better, we've been able to come with newer glasses which cause blockage of these peripheral defocuses and thereby prevent myopia progression. And of course, yoga, going outdoors, and we know by going outdoors and playing, we keep myopia at bay. So this is what I also influence with my kids: more outdoor activity, better lighting, and reduction of screens. So I wish all of us also practice that in our OPDs. Thank you.
That's wonderful words of wisdom from Dr. Aditya. I think one of the most important factors in control of myopia is environmental modification. That goes without saying that most of us, since years altogether, used to believe that you should go out and play, and that would help in myopia. Still, even if we are using, we will be seeing in other talks also, whether you use atropine, DIMS, peripheral defocus lenses, environmental modification holds the key. It is very, very important to believe in that. We can take questions in the end. Yes, sir. Please go ahead. I don't know.
It's an excellent talk, but basically, during the period of COVID, when the children were glued to the mobile games, the incidence of the refractive error did go up. And this is called as a mobile laptop syndrome, where the children, the age group of 5 to 6 years, playing games for a very long time in those period of COVID, complain of eye ache, headache, eye strain, change in atmosphere, dry eye. They sleep with these mobiles, abdominal pain, strabismus, ophthalmoplegia, even autism, delayed milestones, and epileptic attacks have been reported. So the thing is that the surgical treatment of myopia is twofold. What I have seen in Kellogg's Eye Center and Bar is orthokeratology, where they use these ortho-K contact lenses, which are put during night, they cause corner shipping, and the myopia is treated for a couple of days. It is very good. But that sort of a modality may not be helpful in India, where a low-grade doses of atropine does play a part. But at the end of the day, as this young man spoke an excellent lecture, is that I have written an article on skin types causes, and uh, the role of parents in mobile data abuse by kids, that we have to basically teach the parents that they should not give these very costly mobile games to the children who play games, encourage them to play games outside, and that is the key. Thank you.
Thank you so much, sir,